HIV, hepatitis B and hepatitis C are the three blood-borne viruses. HIV is the cause of AIDS, and infection with hepatitis B or C can lead to liver cirrhosis, scarring of the liver, or liver cancer over time. Nearly 1 in 100 people in the UK are infected with one of these viruses. Treatment is available for all three viruses and is most effective if started before these complications develop. Treatment can only be provided if the people infected with these viruses know they are infected, and around a quarter of all people infected with HIV in the UK don't know they are infected, as they feel well. We think up to half of all people with hepatitis B or C also don't know they are infected. Those who are known to be infected attend clinics and receive treatment for their infection. The treatment not only stops them getting unwell, it also prevents them from transmitting these viruses to others. However, those who haven't been diagnosed early usually present later when complications develop. It's harder to treat them at this stage, and they're also more likely to pass on the infection. People diagnosed late with HIV are 10 times more likely to die in the year after diagnosis than people diagnosed early. Although there have been guidelines recommending doctors test more people for HIV, hepatitis B and hepatitis C for some years now, testing rates have not increased sufficiently to reduce late diagnosis of these infections. We therefore need to look at different ways to identify people who carry these viruses but aren't known to be infected. One possible way is to use a blood-borne virus screening programme. This is where blood samples from people having blood tests at their GP surgeries or in hospital are tested for all three viruses. Since around half of the population have one or more blood tests done every year in the UK, this method could potentially identify a large number of people who are infected with blood-borne viruses but not diagnosed with these infections. The computer systems which arrange standard blood tests could identify people at higher risk of having these infections and select their samples for testing. These samples would then be tested and the results sent back to the doctor, either as an individual result for each virus or as an encrypted result, where the lab says one of these viruses is positive, but not which one. The encrypted result would allow the doctor to call back the patient and prepare them for the news they have one of these infections. They would then send standard tests for each virus before sending the patient to the correct clinic for treatment. Before we can test such a system, we need to know the best way to get consent from people selected for this test, and we also need to ask doctors which way of providing the test results is most ideal.